Hi everyone, my name is Melissa deJonge and I'm a first-year PhD student at the University of Toronto. Before I start, I'd like to acknowledge my co-authors and my supervisor, Dr. Catherine Sabiston, for their contributions to this project. Post-secondary students represent a vulnerable population for experiencing mental health concerns and engagement in health risk behaviors. Engagement in health risk behaviors can compound mental health concerns and negatively impact student learning and campus engagement. Accordingly, there's increasing interest in alternative therapeutic approaches that are focused on encouraging self-care and reducing stress. Of relevance to the current study, exercise is supported as an evidence-based alternative depression treatment approach, and clinician-initiated prescriptions or referrals could support student engagement in exercise as a depression treatment strategy. Yet, research examining whether post-secondary mental health care providers discuss or refer to exercise as a depression treatment approach is limited. As such, using a mixed methods approach, the current study explored post-secondary mental health care providers' prescription practices and beliefs towards exercise as a depression treatment. The current study used a convergent mixed methods design that was guided by pragmatic philosophical assumptions. I'll start by summarizing the quantitative phase, followed by the qualitative phase. The objective of the quantitative phase was to examine prescription practices, beliefs, and theoretical determinants of exercise prescription practices guided by the COM-B model and theoretical domains framework. 153 Canadian post-secondary mental health care providers completed a cross-sectional online self-report questionnaire, and data were analyzed using descriptive statistics and a path model. Favorable beliefs towards exercise for depression were reported, and the majority of mental health care providers reported that they prescribe exercise either most of the time or sometimes. The most commonly reported strategies for prescribing exercise were personal discussion, followed by referral to a community or campus-based program. The path model examining COM-B constructs as predictors of exercise prescription practices explained 48% of the variance in exercise prescription practices and 56% of the variance in motivation. Capability and motivation had a significant positive direct effect on exercise prescription practices. Capability also had a significant positive direct effect on motivation. There was no significant direct effect of opportunity on motivation or exercise prescription practices. Regarding the indirect effects, capability had a significant positive indirect effect on exercise prescription practices through motivation, with the relative contribution of the indirect effect being 66%. There was no significant indirect effect of opportunity on exercise prescription practices. That brings us to the qualitative phase. Mental health care providers who completed the online survey and expressed interest in a follow-up interview were recruited to participate in one-to-one semi-structured interviews. Interviews were conducted to provide contextual details to the quantitative findings. Interviews were audio recorded, transcribed verbatim, and analyzed using thematic analysis. The ambiguity of a prescriptive approach to exercise was suggested. Specifically, a prescription was discussed by many of the mental health care providers to be something they would not necessarily provide to a student. However, a prescriptive approach was also discussed to have potential benefits for improving awareness of exercise as an evidence-based treatment. This was discussed as important as many of the mental health care providers explained uncertainty towards exercise as an evidence-based treatment. In this way, there is a suggested need to implement strategies to enhance knowledge, awareness, and student uptake to exercise as a depression treatment approach. Specifically, a number of strategies to address student barriers to engaging in exercise were discussed, and examples are provided on the screen. Additionally, the importance of developing interprofessional partnerships and communication strategies to promote exercise for student mental health were discussed, along with the need to improve mental health care providers' knowledge of the evidence supporting exercise for depression. Taken together, exercise was primarily incorporated as a depression treatment strategy using informal discussion, and uncertainty towards exercise as an evidence-based treatment approach was discussed. Drawing on the COM-B and integrated qualitative and quantitative findings, strategies to target mental health providers' motivation and capability to prescribe exercise are needed. Despite the strengths of the current study, the findings need to be interpreted in light of several limitations, including self-selection bias and the cross-sectional relationships in the quantitative phase. To conclude, the results provide implications for targeting mental health providers' capability and motivation to incorporate exercise within depression treatment plans. This may be important for improving the use of exercise as an alternative therapeutic approach to support the mental health and well-being of post-secondary students. Future work is needed to develop tailored, evidence-based resources, programs, and initiatives to help facilitate mental health providers' exercise prescription practices. Thank you for listening, and I'm happy to answer any questions.